section 2 or part 2 of our peptide talk. Let me just share the screen here. Here we go. This is where we left off last time, and hope you all remember. One thing I wanted to bring up, and that's very important, and that is this. There. Remember we talked about the amino acid structure. We talked about what an amino acid is, basically. And it is nitrogen, carboxylic acid group, and then all these different side chains that can be bigger and bigger and bigger. Anyway, the important part is this nitrogen. Now, where does it come from? So how are amino acids made in the first place? So they're made, nitrogen comes from the air. I think 78% of the air is nitrogen. How do we get that into organic material? And we get that in there through microorganisms, bacteria, okay? And it's the microorganisms in something called rhizomes on the roots of certain plants and other ways that we get nitrogen fixed. It's called nitrogen fixation. So I just wanted to let you know that when we're talking about protein and amino acids, that which they're made of, this all comes from non-animal sources. And again, microorganisms, do we want to wash them all away? Make sure that we're not getting microorganisms on us, right? We want to make sure that. We're all familiar with leeches, and we try to avoid them if we go swimming in places that are not our neighborhood swimming pool. But what we see here in leeches is they're now being used medicinally, and the FDA has now approved them. Isn't that nice? They've approved them, but they now work. Now, why do leeches work? Why do they help clean up wounds and help repair tissues and heal wounds? Why do they do that? Because they secrete a peptide called hurlin, and it is got what? 63 amino acids, okay? And what does it do? It's an anticoagulant. It basically blocks coagulation. It stops blood clots. So if you've got an area that needs to be cleaned up and you put a leech on it, it will actually improve the blood flow, and it will allow things to, nutrients to come in and waste to be taken out. So amazing. Now, here's our, you may or may not be familiar with the Gila monster, but it's not really a monster. We have gotten 8 FDA approved drugs from them, okay? These are all peptides, peptide hormones, okay? And here's a list of them, okay? These are the 8 peptides produced by these guys that are now in medical use. Now, this is one scorpion that you should be really happy about. It's called the death stalker scorpion. So you're not happy about that, but what you are happy about is the way it works. It produces something called Chlorotoxin, a 36 amino acid peptide. Now, in neurosurgery, when the neurosurgeon is doing a surgery in the brain, especially if the brain has a tumor, in the glioma. Glioma is a cell type that's in the brain. And we're looking at glioblastomas and different kinds of brain tumors. Well, the glioma that has the tumor is where this chlorotoxin would bind to. It only binds to the tumor cells. It does not bind to normal cells. So when they inject this peptide into the brain, they'll be able to specifically identify which cells are cancerous and which are not. And that way the neurosurgeon who's wearing his spectacle and his microscopic spectacles can look at it and see exactly where is tumor, what is not tumor, and cut out just the tumor, okay? The other secondary benefit is that the cells that it's binding to, the tumor cells, it actually blocks more growth. So it's therapeutic as well as diagnostic in that it's helping the neurosurgeon distinguish between cancer cells and non-cancer cells, okay? And this is to show you, this is as of 2018, there were 60 peptide drugs approved. In the US, Europe and Japan. Over 150 are now active. 260 have been tested in clinical trials. Okay, these are studies I'm talking about. Now, what I wanted to show you this for is, if you look at the time periods, 1980, the 80s, the 90s, 2000s, and 2010s, the present, I want you to see that most of the research, most of the ones that have been approved, are peptides that are 2 to 10 amino acids. Okay, so they're very small. Okay, very small little groups of amino acids. What's the beauty of an of a peptide, using the peptides? You simply can't overdose. You get a little bit too much of it. It'll downregulate receptors, so it won't be effective anymore. But in terms of causing any damage, it won't. Why won't it? Because if there's any excess in your body will break it down just like it does any other protein, and it'll break it down into amino acids, which go into our main amino acid pool, and they're not dangerous, they're nutrients. Okay, so summary. Peptides are naturally occurring bioregulatory chemicals that control hormone, that are control hormones. They're cell-to-cell communication and cell signaling. That's what they do. They signal, they communicate from cell to cell. These are naturally occurring substances the body produces. We define a peptide as being composed of less than 50 amino acids, 50 or less. And there are two kinds. Some are made or are synthetic, produced in the laboratory just by bringing peptides together. It's a simple reaction. Or they're bioidentical, as we get them out from a natural substance, like the Gila monster and like the scorpions. The body produces almost 300,000 of them, and these are naturally occurring substances that help our cells communicate to each other. That's how we have 100 trillion cells that are working. They're talking to each other, and they're signaling each other. We have 7,000 in clinical use, and let's talk about what are the therapeutic uses. Well, increasing growth, sleep, that's wound healing as well, improves immunity. They balance sex hormones, fertility, menstruation, libido, sexual function. They slow down aging, they improve memory, help you think clearly, and direct killing of cancer cells. The ones that I wanted to discuss today, we won't get through them all, but here's a list of them, and let's just jump right in and talk about them, okay? Now, the pineal gland you are probably familiar with because it produces melatonin, and melatonin is a substance that's produced when light goes, when the ambient light, the light in the environment, in the room, goes down below a certain wavelength, then it's no longer activating an enzyme that allows, that prevents melatonin from being produced. Let me clear that up. Tryptophan, which is an amino acid we need, it's one of the essential amino acids. Tryptophan goes through a process of that becomes serotonin. Okay. If the light's on, it'll produce serotonin. When the lights go off, it goes down further down its metabolic pathway to produce melatonin. Okay? Now, melatonin cleans up the hydroxyl radical, which is a dangerous free radical that's produced as a metabolic intermediate throughout the day. It just engages when you're engaging in normal metabolic processes, but it accumulates. If it's not used, when it's a product, a byproduct in metabolism, it's used for certain things. Okay, well, some of it starts to accumulate. In fact, it accumulates in great amounts. All right. Also, toxic exposure produces different free radicals, and one that's probably the most dangerous is the hydroxyl radical. In fact, it's this free radical, hydroxyl radical, that's produced from EMF. So when you're exposed to EMF, that's what happens, okay? So anyway, so while we're asleep, melatonin does a few things. Number one, it makes us sleepy. When the lights go off, it makes us sleepy, produces melatonin. Melatonin makes us sleepy, number one. Number two, it starts cleaning up all the hydroxyl radicals. Each melatonin molecule can grab 4 hydroxyl radicals. So it's a really good night janitor. And then number 3, it stimulates T cells, stimulates natural killer cells and everything. So going to sleep early enough and getting enough sleep is going to allow you to clean up enough mess and enough metabolic garbage, and also to enhance your immune system, okay? What else does the pineal gland produce? It produces something called dimethyltryptamine, which is also well known by some of you as ayahuasca, okay? Turns out we make our own ayahuasca, and it's necessary. It's thought that at the moment of death, what happens is that the pineal gland just spills tons of DMT in, and it results in the metabolic transformation of the spirit leaving the body, okay? But during life, it gives you these transcendental types of experiences, which we're getting at little times for different situations during the day, like times of insight, times of feeling beautiful and loved and warm, and all sorts of things, these minor transcendental situations, feelings. But this is the biochemical pathway, the bridge, okay? So, and melatonin, I just want to remind you, it also influences FSH and LH as well. Now, a third hormone that's produced, it's only 4 amino acids, it's called epithalamin, okay? Epithalamin that is produced also increases melatonin production, so it kind of is one of the managers of the pineal gland. It's an antioxidant. It inhibits the formation and growth of cancer. And this is the big one, it elongates telomeres. And you're all familiar with, once your telomeres at the end of your DNA are too short, then it stops being able to reproduce and your cells die. Okay, so when we look at anti-aging, we look at increasing telomere length, okay? It lowers inflammation, regulates your endocrine system, it does all sorts of amazing things, epithalamin. But increasing telomere length in terms of anti-aging, also telomere length is related to cancer progression. So here's a study that shows that that the increase in telomeres by 33%, that's a big deal, okay? So in terms of longevity, you see here's the telomere at the end of the chromosome, and it starts to get shortened and shortened and shortened every time the cell divides. When it gets too short, the cell no longer divides. Well, here, if you can keep them long and your cells keep dividing, you can stay alive, okay? Now, this hormone, this peptide was discovered by a Russian scientist who was using it on his mother, who I think in her late 50s started it, and then she's up in her mid 80s, and he says she really hasn't aged that much. Now, they did this study with mice, and they increased their lifespan up to the equivalent of 100.7 human years. Here's the studies. Now, in a human study, it was a 15-year study, which is significant. 79 participants between the ages of 60 and 69. And what did they find? Here we go. You'll see cardio. Now, the upper curve is death, is the epithalamin, and the lower one is the controls, those that did not get epithalamin, okay? Cardiovascular deaths from those who did not get it in that period was 83%. With those who got the epithalamin, only 46.2%. In terms of survival, the control group that got nothing, 40%. Epithalamin, 66.7%. Okay, so that's a human trial. The doses are varied, but basically you don't want to get more than 300 milligrams per year. And you do it every 6 months. You can do a dose. You can do 10 milligrams a day for a period of time until you get to 150 milligrams. And then you can do that again in 6 months. So you keep it within 300 milligrams a year. Just a graph to show you the pineal gland. When you're born, it's small. And then at 50, it starts to grow and reaches a peak at 5 to 10 years. then it starts to go down. But by the time you're 35, by the time you're 50, by the time you're 60, by the time you're 70, and when you're over 70, basically at that point, your pineal gland is not working. Now, we know that our pineal gland gets calcified, and that's why we want to avoid fluoride, right? And we want to avoid fluoride toothpaste and all that stuff because it causes calcification of the pineal gland. Now, it's been, if we go back to that slide, we'll see here. There we go. There we go. Yeah, the third eye, pineal gland. So, and why? And that's probably related to the dimethyltryptamine that's being produced. Okay, so again, how to avoid fluorinated water, use a fluoride-free toothpaste, eat organic vegetables. You can stimulate the pineal gland with raw chocolate. And by the way, you can get chocolate that's not been sweetened. If you get the raw chocolate cacao, there's no sweetening. And then you can use different kinds of artificial, stevia is a plant. You can use that to make it taste sweet. But melatonin also stimulates the pineal gland, and so does epithalin. Okay. Get rid of your mercury fillings, and meditation gets rid of calcifications and increases epithalin, increases melatonin, increases dimethyltryptamine. Now, this is a 7 amino acid hormone peptide that I love. It's called Semax, and it comes from Pro-opiomelanocortin, okay, which is a large protein that's made in the brain, and it gets broken down and produces other little peptides called, here's the gamma MSH, the ACTH, alpha MSH, CLIP, lipotropin, and then endorphins. You're familiar with endorphins, and beta MSH. Okay, these are the different derivatives from the large POMC. Okay, now the Semax is amazing because it's been shown to increase brain-derived neurotrophic factor, BDNF, a nerve growth factor, and tyrosine kinase receptor type 2. All of that does what? This is a study. What does it do? It increases your memory, it increases your concentration. Really important, especially today. Prior to learning about this, what did people use? Adderall, Ritalin, what's that other one called? Modafinil. Okay, these are drugs. They're drugs. And all drugs are going to have problems because they're not natural. They're going to stimulate and do things in the body that are dangerous. This here is naturally produced. Now, it's neuroprotective. That is, it actually can protect neurons from being oxidized, inflammation, okay? Now, glutamate is toxic to neurons, brain cells, okay? So they did a study where they exposed neurons to glutamate, and the Cmax improved the survival by 30%. Cmax also chelates heavy metals. Why is that good? That's really good because it chelates copper, and copper is absolutely necessary for angiogenesis. In fact, there is a treatment there are ways. One way of treating cancer is to get really powerful copper chelators and get your copper levels so low. If your copper levels are very, very low, then you simply cannot have new blood vessel growth. You simply cannot have a tumor grow. Okay, there's obvious complications from that, right? You need to have some new blood vessels growing all the time. Okay, so you can't just do that. However, vitamin C, and we'll talk about it in other lectures and talks, webinars, we'll talk about natural agents that block angiogenesis only where we want it to, okay? But so here's the thing, you're chelating some of the copper, which is good, so you're preventing angiogenesis when you're doing Cmax, but you're also dealing with the fact that getting diagnosed with cancer is the same condition that someone experiences who goes to war, who gets raped. What is the condition after those situations happen? It's called PTSD, post-traumatic stress syndrome. And in post-traumatic stress syndrome, people are just shocked, unable to work, they have terrible dreams. Well, this is not very different than for people who have cancer, okay? So Semax, so you're gonna have this confusion, the loss of focus, all that sort of thing. You know, people that have been diagnosed with cancer, they can't read long things, they don't have an attention, and because they've been shocked to death. Why have they been shocked? Because of what they've heard about cancer. And we'll talk about this again and again and again. But cancer is not a sentence, it's not a death sentence, it's just simply a word, okay? And it's simply a part of our body that's going through a survival thing. We need to turn it off, but it's doing something, okay? So, but it's not all that other stuff. That's not, you're gonna die if you get cancer. That's not true at all. And I can say that with a lie detector, because I've seen it thousands of times. Okay. So it's a nootropic, okay? So it helps improve nerve function and memory. It's very, very important, okay? So now the good thing is most of these peptides, you have to get a little, it's a little needle here, but it's a little needle with a teeny little, it's a little syringe with a little teeny needle. You grab a little piece of belly, you don't even feel it, most of them. Well, some are made now where it can go through the nose, and Semax is one that you can get in a nasal spray. What is good about that is you actually get a better effect through the nose because we have enzymes in the blood that might break it down to some degree of the Semax. However, when it goes into the nose, it goes directly in through the cribriform plate up into your brain. So it's very good. Here's a study that shows that, yeah. So it's also used for people with organic actual injury. So traumatic brain injury, which can happen from any kind of accident, okay? It's actually very, very helpful. Here's a study showing that it improved recovery. And they assess this by looking at EEG, electroencephalograms. Okay. All right, I just, okay. Yeah, well, okay. We're changing gears now. We're gonna go into looking at immunity, something that's essential to healing from cancer, okay? And I just wanna try to draw your attention here to, there's the T helper cells, there's the Th1 and there's the Th2. The Th1 side of things, if you're polarized towards Th1, then your body, your T cells are able to grab cancer and kill it, grab viruses, grab, funguses, go after things and get rid of them, right? The Th2 is another one. It's a bloodborne thing. It's a different kind of immunity. You need to have both, but you want to be really polarized to Th1. If you get polarized to Th2, you're going to wind up getting chronic infections and cancers and stuff like that. So what are the things that do this? Well, there are certain thymic factors. Now, we have a gland called the thymus gland. I'll show you in a moment. But it increases IL-2, interleukin-2. What else works? We know that licorice root works. We know that dong quai works. We know that beta-1,3 glucans work. You might have all heard of that kind of stuff. Cytokines, I mentioned the word interleukin-2. That is a cytokine. Cytokines are chemical messengers that control the immune response. They're produced usually in white blood cells, T lymphocytes and epithelial cells that line things. Okay. And as I said, there's two kinds of T helper lymphocytes, T1 and T2, and the balance between 1 and T2 determines the type of immune response. Okay, so Th1 promotes cell-mediated immunity. Th2, as we said, induces humoral immunity. Okay. But this Th1, the one that we're interested here with cancer, is the killer T cells, CD8s, and natural killer cells. Now, a failure in the Th1 arm of the immune system and an overactive Th2, you wind up with all these problems. Okay, so all of the Gulf War syndrome, and we all know that the Gulf War syndrome was really due to a set of vaccines that was given to the Gulf War soldiers. Because how do we know that? Because even the soldiers that were inoculated and never left America got Gulf War syndrome. They didn't have to go to the Gulf War. AIDS, chronic fatigue, etc. So Th1 cytokines such as interleukin 2, interleukin 12, gamma interferon, etc. All of those we want. Okay, so the thymus gland, okay, so here it is just below the chest bone, okay, sitting at the upper part of the chest between the two lungs. It's called the thymus gland, okay? And what does it do? The thymus gland is where lymphocytes that are produced in the bone marrow go to, and they get trained to kill, to be assassins, okay? But they don't have a target yet. They're gonna need to be instructed, all right? But anyway, that's what happens. Also, natural killer cells get activated, etc., from the thymus gland. Essential for your Th1 immunity, okay? Now, as we age, the thymus gland shrinks. Let's look at how it does, okay? So at birth, it's 15 grams. At puberty, you're up to 35 grams. 25, you're down to 25 grams. 60, 50, 15 grams. And it's 75 grams, okay? So basically, it's shrinking. What else is shrinking? Your immunity is shrinking. Okay, that is a big deal. Okay, so and there's not much you can do about a shrinking thymus gland. Now, the thymus gland produces different kinds of peptides that do the job we're talking about, right? And so when the thymus gland shrinks, you go from a Th1, which you want, to a Th2. Okay, and Thymosin Alpha 1 and Thymosin Beta 4 are two main peptides that are produced by the thymus gland that you lose as you get older, okay? And here's another thing, the decreased telomere length in your immune cells. In other words, your immune cells can't continue to reproduce, so your immunity goes down. So Thymosin Alpha 1, which is a well-known peptide that's FDA approved in like 65 countries, pretty amazing. And so it's 28 amino acids. It enhances T cells, dendritic cells, antibody responses, modulates cytokines and chemokine production. It enhances natural killer cell system. It's what you want, okay? Now, so even if you're 35, you still have it somewhat shrinking. You're 25, you're still somewhat shrinking. And even if you're in your teens, but you're sick with cancer, it's all gonna, it's cell-related immunity, cellular immunity is gonna be decreased. So here we go. So here we go. Yeah, I just wanted to show you this. We're not going to go over this in detail, but this is kind of the process by which TA1 works. Now, it's called a brand name of Zadaxin, okay? Zadaxin. So you can get that basically in many countries if they'll sell it now. The reason that it's going to be harder and harder to get is because it's been found to be useful with COVID. And because of that, it's going to get harder and harder to get, okay? But we can still get it, okay? Now, anyway, secretes interferon gamma we talked about, IL-2. Once you get the Thymosin Alpha 1, you get that, you're injecting it. Now, it's real simple. You inject it daily for about 2 weeks, 10 days to 2 weeks. A little, just takes a second. And then you do it just twice a week. Easy. Keeps your cell immunity, keeps your immune system ready to do its job, okay? It restores natural killer cell activity. It's a big deal, okay? Here's a study looking at Thymosin Alpha 1 reduces the mortality of severe corona 29, right? And so that's why we don't. It's harder and harder to get. Improves tissue repair and healing, improves host defense, infections, improves microcirculation, and inhibits viral replication. All right. Promotes a Th2 to a Th1 shift, which is what you want. Okay. Thymosin Alpha 1 deficiency, which we're all getting, fatigue and lacking motivation, physical exhaustion, chronic infections, slow wound healing, joint pain. Okay, so physical signs and biomarkers of Thymosin Alpha 1. Anyway, it improves HIV because of the low CD4 and CD8 ratio, increased inflammation markers. I use it myself, absolutely. Approved in 35 countries. No documented adverse effect. Use subcutaneous. FDA approved. Now, thymosin beta 4 is one that I'm not going to really talk about right now, but it helps for inflammation, healing. It's amazing if you don't have cancer. If you have cancer, it stimulates angiogenesis, so we don't want that. I won't talk about it now, but for people who don't have cancer and they're healing wounds, etc. Now, let's go back here to the pro-opiomelanocortin, okay, this large molecule here, which has babies coming off of it. And we'll notice that the alpha, MSH, coordinates sexual behavior. This is produced in the brain, the hypothalamus. Alpha MSH from the intermediate lobe pituitary regulates melanin, which is your pigment. Okay, ACTH, again, that has to do with adrenocortical, it stimulates your adrenal glands to produce cortisol, things like that. So DHEA, aldosterone, and then beta endorphins. Melanotan, which is a derivative. Now this, I'm not going to spend too much time on it, but just to let you know, and this is important because when you have cancer, one of the problems, you want to live a normal life. So what I do with integrative oncology and with all good integrative oncologists, our goal is to make sure that you are having as normal and happy as life as possible. You're able to eat and enjoy your life. You have energy. You go exercise. You go to work. You dance. You can go to parties and be with your friends and all that stuff. And part of being happy and alive is having sex. We all know that. So sexuality changes with cancer because your hormones get all messed up and all that. Now, I won't talk about the melanotan 1 really increases your pigment, and so it's good for vitiligo, if anyone knows what that is. But melanotan 2, which is also called PT141 for men, gives a very powerful erection that lasts several hours, and even men who have taken Viagra or Cialis or what's the other one called? Yeah. Anyway, that work locally down at the reproductive organs. This works centrally, so that even people that are immune to that will still get the erection. So it's very good for men. It also stimulates their the whole sexual process. Now, it improves libido, sexual function, etc. Right? It activates endogenous, that means inside pathways of the sexual response, because it binds to these receptors. Now, it's now being called the female Viagra. In this study here, this was a study a while ago, 2006. Premenopausal women with sexual arousal disorder, they gave them PT141 and they all reported to have moderate to high sexual desire following this PT141. Then there was a study afterwards, which I don't have on here, but it became FDA approved in the US, and it's called, it's the female Viagra. Women use a little higher dose than the men, and because women, it's different. They're not looking for an erection; they're looking for other kinds of physical effects, such as increased sensitivity of the labia, clitoris, and inside the vagina. So now, even though it is not melanotan 1, which causes people to get dark, it can cause darkness. It can cause you to look like you had a tan. So this is, in Asia, that's a bad no. Nobody in Asia wants, if you've ever come to Japan or Thailand or anywhere like that, people use umbrellas not for the rain, but for the sun. They don't want to get dark. Being dark to them is terrible. Whereas in America, we're out there all, every summer trying to get dark. Well, now you don't even have to go to a tanning booth. But again, the PT141 is not really powerful. You're not going to wind up very, very dark. But you might get dark, like if you have freckles, you might get dark freckles, or might not. A lot of people don't. Or you might not. I mean, I've had many patients who don't feel anything from it. I mean, in terms of darkness, but they still get the sexual. So here it is, the female Viagra. Yeah, there it was, 2018. And by the way, men, if men are going to do it, do not use Viagra or Cialis or anything else, because it's too much. Then you might wind up with something called priapism, which is an erection that won't go away, and that is painful and something you don't want. Okay, so now this is a peptide that actually brings about puberty, and this is helpful for women regulating their menstrual cycle. So women that have irregular menstrual cycles. I'm not going to go into it too much, but the reason it was called Kisspeptin because it was discovered in Hershey's, Pennsylvania, when they make the Hershey's Kisses. Anyway, but the reason it was originally used was for human metastasis suppressor gene. Okay, so it is good in breast cancer metastasis, but it regulates hormones as well, and it increases LH and FSH. And you might think, well, yeah, but I've got an estrogen receptor positive tumor, blah, 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 blah. It doesn't matter. Remember, we've always talked about bringing things into balance so that you have enough estrone, estradiol, estriol, you have enough progesterone, you have enough DHA, you have it all in balance. Balance is not sick. Balance is not cancer, okay? So anyway, Kisspeptin stimulates the central part of the hypothalamus, which regulates the pituitary. Winds up increasing testosterone, etc. Anyway, we won't talk about that. Now let's just talk about sleep. People have a lot of trouble sleeping when you have cancer. Okay, that's very important. And CJC 1295 promotes slow wave sleep. Why is that important? If you remember, we have, here it is, yeah. Beta, you're wide awake, you're having a discussion or a debate, or you're studying. Alpha, you're kind of relaxed now, you're not thinking too much, you're just kind of cruising, you're mellow. Theta, you're in a dream. This is what we have when we're dreaming. Both alpha and theta are associated also with the meditative state. And then delta, you're in deep sleep. And this is very, very important. It's slow wave delta sleep. And this is the part of sleep where we are restoring, our body is restoring all the wear and tear that's gone on throughout the day is being restored. That's why you got to go to bed early. We'll talk about that at another time, but you got to go to bed early. But anyway, so the CJC 1295 increases that, and so does deep sleep induced peptide, which is called DSIP. It's only 9 amino acids, and again, helps you sleep. They did a study with insomniacs, chronic insomniacs. There are some poor people that never sleep. I've had people come in who haven't slept in decades. Just little bits here and there. Can't imagine it. Now, I want to talk about a few drugs, and I don't have them all. I mean, a few peptides, and I'm going to expand this lecture because after this here, I'm going to expand it to include more of the work we've done with cancer, but let's just go through it a little bit. So, different kinds of peptides that are used that affect gene expression, systemic modulation, the mTOR, AMPK pathways, P53, which is tumor suppressor gene, and all that. Here you go. Yeah. If you understand that, you understand a lot. But anyway, this is immunity. This is the things we were talking about with immunity. And we want to wake up the immune system, and we want to directly get rid of cancer cells. So let's talk about some. Now, these are the different peptide receptors which have potential in cancer therapies, right? And here they are. We'll go into them all at some other point. Now, the one that I like a lot is the opioid growth factor, or metcathelin 5, okay, or MET5. MET5 because it's only got 5 amino acids. It's an endogenous pentapeptide. The endogenous means it's produced in the body, okay? Now, this is part of the opioid growth factor, MET5, is part of the pathway that regulates cell growth in normal and abnormal cells. Okay? Regulates cell growth. Why is that important? This is the receptor, this is the peptide. Controls the cell cycle. So here's the G1 and the S phase of the cell cycle. If you can stop the cell from dividing, you have stopped the cancer. Okay, so P16 and P21 are affected by this. So in the cancer studies, this is a study, Zagan et al. It's found to kill colon cancer, pancreatic cancer, squamous cell cancers, which are of the head and neck, also of the cervix, and they're also involved with skin, neuroblastomas, brains, kidney cancers, triple negative breast cancer, and of course, not even triple negative, triple positive as well, ovarian cancer. Anyway, so there's phase 1 clinical trials going on with it. It enhances the chemotherapies, the gemcitabine, the 5-FU, etc. Here is the study, and I'm just going to go read the highlight of it. This is immunotherapy of cancer via mediation of the cytotoxic T lymphocytes by methionine and enkephalin, MCAN, that we've been talking about, okay? Our findings in vivo, in actual people, and in vitro show that MCAN, menenkephalin treatment upregulate the percentage of CD8 T cells, the ones that kill cancer cells, the activated T cells, all right? And increases cytotoxic activity against tumor cells and secretes interferon gamma. We've talked about that before. Here's another study, killing the effects on melanoma in vivo and in vitro, okay? Basically same sort of thing. And here, it is concluded that menenkephalin could exert anti-tumor effects through precisely regulating opioid receptor-mediated functions in dendritic cells. Dendritic cells are one of the two cells, the macrophages and the dendritic cells, that instruct those brand new graduates from the thymus, the T cells, the naive T cells, instruct them on what the tumor looks like and where it is and how to get it, and it does it. Okay, so the dendritic cells are very important. This upregulates them. That's a big deal. Methionine inhibits regulatory T cells, Tregs. Why is that important? Because cancer cells turn on cytokines that increase inhibitory Tregs. Tregs stop all the other cells, the natural killer cells and the T cells, from killing the tumor. Why do we have that? Because if we didn't, we'd all have autoimmune diseases. We'd be going crazy. So we need Tregs to kind of keep it balanced. Everything in the body has got a yin and a yang. Everything is going to do something and something else is going to slow it down. So we modulate. This is how balance occurs, okay? Homeostasis, okay? So Tregs are important, but they get upregulated with cancer, which is one of the ways the immune system gets knocked out. This turns that off. Now, this is here with clinical benefit in survival with patients with advanced pancreatic cancer, okay? Big deal. Different kinds of dosing, which we will talk about if any of you are interested and we want to have a discussion personally about your cancer, or if you get a doctor who will order this stuff for you, then I can help them and you, okay? But the maximum dose is 10 milligrams, subcutaneous, little injection twice a day. Now, PNC27 is a very incredibly promising peptide for cancer because it binds to the HDM2 protein that is expressed on the cell membrane of only cancer cells. Non-cancer cells do not produce this protein, this receptor. Do not. Therefore, it can't hurt your healthy cells. You're not going to get that kind of toxicity from it, okay? So what happens is the PNC binds to that, and then it produces a a pore, a hole. It makes a hole in the cell and the cell dies. But it dies by necrosis. Now, there's two kinds of cell death. One is necrosis and the other one is called apoptosis, apoptosis, all kinds of ways to pronounce it, like tomato. Anyway, necrosis is like squashing a cell. When you squash a cell, when you squash it, you're going to have debris. You're going to have metabolic garbage. You're going to have this come out and this come out and this come out, and it's all going to be in the blood, and you're going to get sick. Okay, so if you have a lot of necrosis, so there's something called that you may have heard of called tumor necrosis syndrome, and that is when a cell is dying through necrosis too quickly, your body's going to feel poisoned and you get sick, and it can be damaging to your kidneys and be fatal. Tumor necrosis syndrome. So that's why most therapies that we use, vitamin C and all that stuff, stimulate apoptosis. Chemotherapies in low doses, used appropriately, going to stimulate apoptosis, not necrosis. Now, but the fact that this does that the PNC27 causes that, that's fine. That just means you have to do it slowly. You can't do it quickly. So what we're finding is that instead of giving yourself subcutaneous, you need to have a doctor who's going to give it to you in IV doses daily for 5 days a week. And it will actually basically kill the tumor. And this can probably, if we ever figure it out, which we will, replace chemo altogether. Okay, so it might be that you do it 5 days in a row, and then you don't do it for 10 days, and then you do it 5 days in a row, and then you don't do it for 10 days. Or maybe you do it for 7 or 10 days in a row, and then you don't do it. Okay, whatever, we got to figure that out. But this directly kills cancer cells. And remember, it's not damaging your healthy cells. What happens is when you kill a cell too quickly, when you kill too many cancer cells and they start breaking down, they start releasing uric acid and a lot of things like that can cause damage. But if you're doing it slow enough, that's not going to happen. You're just going to kill the tumors and shrink them down, and they're not going to be able to grow because you'll be doing all these other things. So here's a study, 2015, with ovarian cancer. These findings show for the first time the efficacy of PNC27 on freshly isolated primary human cancer cells. Our results indicate that the potential of PNC27 peptide as an efficient alternative treatment of previously untreated ovarian cancer, as well as those people who have had ovarian cancers, but they're resistant, become platinum resistant. Okay. Here's a study, 2014. The anti-cancer peptide PNC27 induces tumor cell necrosis of a poorly differentiated, non-solid human leukemia cell. Big deal. So it's not just solid tumors, also leukemia. Now, GHK peptide is used, and especially the GHK-Cu, which is copper peptide, has been used in dermatology, aesthetics. It makes your skin tighter, makes you look younger, and all that sort of thing. But what I love about it is this. GHK suppresses RNA production in 70% of 54 genes that are overexpressed in cancer patients. Pretty neat. And it reactivates apoptosis. Remember how important that is. But while you're getting this, it tightens, loosens skin, it reverses the thinning of aged skin, protective barriers of skin, improves skin firmness, elasticity, clarity, reduces fine lines. So as you can see, you can get this made into a topical agent, which you can rub on your skin and all that. Stimulates wound healing, reduces inflammation, blah, 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 blah. And if you have photo damage, which if you've been out in the sun too much, if you have these hyperpigmented spots people get, etc. And the doses and all that. So anyway, that's it for this segment of peptides. And as I said, I'm going to get more into the rest of the other peptides we do. And I also want to talk to you about mitochondrial peptides, because remember, cancer is a mitochondrial problem, okay, because there's no such thing as disease. And I'll see you next time.